thank you very much for joining us on this very, very warm day. How are you surviving over there in St Albans?
Plenty of water and air conditioning, basically. But
Oh no, the air conditioning! So jealous. Never thought I'd see a day where I say I need air conditioning in Scotland, but today's definitely a case for it, I think. So I have to have a conversation with the landlord, I think. But thank you very much for joining us. Like I said, really excited to have you on. For anyone who doesn't know you, I'd absolutely love for you to introduce yourself and tell me a little bit about your journey into dentistry.
my name is Prakash Pramod. I started out as a dentist, going to dental school in Manipal in India. Qualified in 2000. Came over here 2003. Worked in different maxillofacial surgery units around the country, starting at East Grinstead in West Sussex and ending up at the Royal Free in central London. On the way, did a medical degree as well at Barts in London, and then surgical training in general surgery, orthopedics, plastic surgery, and been around, come around full circle, and now I do mostly dental implants, oral surgery, a little bit of cosmetic dermatology and skin cancer reconstruction as well.
Oh, wow, amazing. So you just do everything then, really. And what's that dual qualification? So tell me a little bit about that. What came first, the dentistry or what? Yeah, what one did you think
So,
came first?
I actually come from a family of doctors. My dad, my grandmother was one of the first
Oh wow.
in India, one of the first gynecologists in Kerala as well.
Oh, amazing.
My brother's a doctor, all uncles, aunties, lots of relatives, all doctors. And when I was a young man, I wanted to be a rock star. So obviously it didn't go down very well when you have that
Yeah, I
sort
can imagine.
of family full of doctors. And ended up getting into dental school, great dental school, had a great opportunity to learn and train with some of the best dentists in India. And from there, I got interested in surgery. Again, I wanted to learn to do surgery from British maxillofacial surgeons because that was sort of the exposure we'd had when they would come to India and show us how they were doing reconstructions and everything else over here. So that's why I came over here to get further training and do Royal College exams and bits and pieces. And that was the start of my journey. And then after that, about 20 years in the NHS maxillofacial services, doing everything from wisdom teeth to skin cancer reconstructions, trauma, you name it. And along the way, dental practice, doing dental implants and oral surgery was something I've done for about 18 years now as well.
Okay. So you mentioned there you work for the NHS. You worked for the NHS for, did you say 20 years? So, as I'm sure you can imagine, the NHS is a very popular topic. Well, not just obviously outside of dentistry, but within dentistry. And what we write here is a big topic at the moment, given the kind of access issues that are kind of quite widespread across the UK, COVID backlogs, and just I think general dissatisfaction in many areas with how it's working, and a lot of people are suggesting an overhaul is needed. But there are some people who are really fighting for it and thinking, this is essential for the country. It's part of being in the UK, and it's something that can work if the right funding and provisions are put into it. So, I mean, what was it like working as a dentist in the NHS?
It's a great question. Gabby. I think from the NHS hospital services, where I was a part of for the last 20 years, I think there's always been a lot of strain on the services. There's always been a lot of referrals that we just can't see in time, because a lot of the straightforward routine referrals such as dental extractions and stuff often gets delayed because of trauma, cancer and everything else. And you're absolutely right, that backlog got a lot worse with COVID. One of the things I do remember from when I was in the front lines during the COVID pandemic was, with all the dental practices closed, we were literally seeing toothache. People coming in with toothache, chipped teeth, broken teeth from anything. And it was just really, really, really sad to see how the pandemic literally brought the country, the dental profession, pretty much everything to its knees. And we're in the aftermath now, so hopefully it's a time to rebuild and do great things going forward.
Absolutely. What would you say to those who may be feeling a little bit frustrated with what's going on? I mean, do you do any NHS dentistry now?
So the new practice we've set up is basically set up as a surgical center doing dental implants, oral surgery, as well as dermatology and things like that as well. So we're offering hospital level care to the heart of the community in St. Albans, but we are also in talks with local teaching hospitals to help provide surgical services to help bring down the waiting lists that they have, because I think with the backlogs they have, it is hopefully going to be something that we set up pretty soon, that we're able to help bring down the NHS waiting list for surgical procedures in particular, as well as scanning facilities. I mean, we've got one of the best CT scanners in the market, which is often only seen in some of the big teaching hospitals in central London, which also means that some of the patients that have to go to central London to get their scans can actually come to our clinic now.
Oh, amazing.
Through the NHS when the pathway is set up,
And I mean, what was the idea behind that then? Because it sounds like you've got quite a passion for kind of that collaborative effort with hospitals, bringing down that backlog. What's the story behind that? Why is that so important to you?
I think it's the journey I've been on, because I've trained with some amazing people. I've had some amazing opportunities to really expand my horizon, expand my abilities to a point where it's really great to have had those connections, but also feels great to be able to give back. And I mean, I learned skin flaps from plastic surgeons. I learned bone grafts from orthopedic surgeons. I've done minimally invasive surgery with laparoscopic surgeons, and that sort of ability to be able to bring back to dentistry and to be able to have had, you know, the collaborative experiences with those people actually is something that really inspires me to be able to work with these great people I've met along the way, and hopefully work in a setup that we've got that is purpose built, just looks and set up just in the way that I'd like it to be. I mean, well, I've been a patient and I've always wanted, and I've always felt, wouldn't it be fantastic if we had everything under one roof? Wouldn't it be fantastic if we didn't have any compromise in terms of what equipment we have, what facilities we have, and be able to just do that on a regular basis and hopefully strive for that level of excellence throughout.
And how has that been going? Has it been a journey? Any challenges?
That's the $1 million question. I think with everything, it is a journey. I mean, for me, it's probably been the better part of a year just setting up the place, getting from where we were with that dream of we'll have a place, and then the place becoming available, setting up. Getting the equipment, working with great people, having colleagues and friends help out. But we're open, and it's
excellent.
You know, what we want it to be, and it's hopefully one of those things that will be a defining thing for us in years to come.
Perfect. I think a lot of people watching may be asking questions about kind of how you got to where you are. You know, what they would need to do to kind of follow in your footsteps if they were interested in a similar path. I mean, what would your advice be for dentists who may be kind of looking up to you now and thinking, right, okay, that I want to do something like
that? I think invest in yourself. That's the one thing I'd say. I mean, find out what you love doing and focus on that with all your heart, and spend your life, your energy, your career just focusing and getting further to whatever goal it may be. I mean, if you want to be a surgeon, work with the best surgeons. Surgery has always been an apprenticeship. You don't learn that on a weekend course. You've got to work with good surgeons, you've got to get feedback, you've got to try to do things again and again to the point where it becomes second nature. If you want to be a cosmetic dentist, work with the best guys who do cosmetic work, and you've just got to invest in yourself, find the best people to work with. And don't forget to look after yourself as well. I mean, find a hobby you love doing, fall in love. I mean, do something that really inspires you every day, and you'll enjoy the journey.
What's that hobby for you?
I sing and I play the guitar.
Oh wow, amazing!
So, yeah, I've been playing since I was about 7 years old. I played on stage 8.
Yeah.
And lots of shows, performances,
that's fun.
Competitions along the way, and now it's mostly just campfires when I go to my wife's place in America and sing along the harbour. And
that sounds very wholesome. I like that. That's, you know, when I've asked that question in the past, I've never had that answer. So yeah, that's nice. I like that. Well, thank you so much for taking time out of your afternoon. I know you're a busy guy. Really appreciate it, and hopefully a lot of wisdom there that people can take away.
Thank you so much for asking me, and lovely to meet you.
You too.